Hello friends, today we are going to discuss regarding hypertensive urgency. So, hypertensive urgency is a condition in which the blood pressure is severely elevated. That is, it is more than 180 by 120 mmHg with no acute and organ damage. In hypertensive urgency, there is no immediate risk of life-threatening complications. This is distinct from hypertensive emergency in which acute and organ damage is present. Now we will go through the pathophysiology of hypertensive urgency. In hypertensive urgency, although the blood pressure is severely elevated, but the body's protective autoregulatory mechanism is still functioning. So the autoregulatory mechanism acts as a protective buffer. The vital organs of the body, mainly heart, kidneys and brain, they maintain constant blood flow despite of blood pressure variations. So when the BP rises, the vasoconstriction takes place, and when the BP falls, vasodilatation takes place, thereby maintaining constant blood flow. This is called as autoregulation. In hypertensive urgency, the blood pressure rises, so autoregulation leads to constriction of arterioles, thereby maintaining blood flow to the organ, and thus no ischemia, no hypoxia occurs. Now there are basically three main mechanisms. Number one, sympathetic nervous system activation. So there may be triggers for activation of sympathetic nervous system. For example, anxiety, pain, obstructive sleep apnea, alcohol withdrawal. So there is increase in heart rate, cardiac output, systemic vascular resistance, but there is no capillary leak or capillary rupture. Second, renin-angiotensin-aldosterone system activation, that is RAS activation. So activation of JG cells leads to release of renin. Renin converts angiotensin into angiotensin 1. Angiotensin 1 is converted to angiotensin 2 in the presence of ACE, and angiotensin 2 leads to release of ADH. It causes vasoconstriction and it leads to the release of aldosterone. Aldosterone causes sodium absorption, potassium excretion and increase in plasma volume, thereby causing increase in blood pressure. Then number 3, endothelial dysfunction, which is reversible. So there is reduced nitric oxide, which leads to increased vasoconstrictor tone. However, there is no fibrinoid necrosis, there is no capillary macrothrombi, and there is no capillary leak. These destructive changes takes place in hypertensive emergency, not in hypertensive urgency. So hypertensive urgency results due to neurohormonal activation with preserved autoregulation, thereby preventing macrovascular injury and organ damage despite of elevated blood pressure. Thank you.